Hey everyone, I hope you're doing well and are having a flare-free day. Thanks so much for coming to my channel. Now, I don't know about you, but in conversation around endometriosis, we sometimes come across individuals that talk about their surgical experiences and how they had surgery to formally diagnose that they had endometriosis, confirm the stage of their endo, as well as individuals who had surgical options to help manage their pain and discomfort associated with the disease. Now, surgeries are typically the gold standard of treatment and diagnosis of endometriosis. Sometimes endometriosis can hide on imaging techniques such as ultrasounds and MRIs. If you have a negative ultrasound or MRI for endo, doesn't necessarily mean you don't have the disease. It just means that the tissue, stroma, and adhesions are hiding behind other structures, making it difficult to see and pick up on that imaging. So surgeries are often used as a formal diagnosis procedure to confirm that individuals have endometriosis. When it comes to surgeries in endo, there are often two options on the table for patients to pick between. There's ablation surgery for endometriosis, as well as excision surgery for endometriosis. Ablation and excision, they're kind of big words, and sometimes in an appointment with a doctor, it can get very overwhelming when they present two options to you saying, okay, which one do you want? And you're like, I have no idea which surgery means what the procedure looks like for either, which one's better for me. And so in this video, I'm going to break it down in simple terms of what each surgical option looks like, what the procedure would entail for each, which surgery is a bit of a better option to lean towards in your surgical journey compared to the other option and why that would be, and everything else in between. On my channel, I am very open that everyone's endometriosis diagnosis and treatment journey is going to look different. Sometimes, depending on where you live, you don't have access to surgery if you're in a rural or remote location and not near an urban center with a specialist nearby. Sometimes insurance doesn't cover surgeries and you don't have the income to support that surgery. So that might limit individuals' opportunities to opt for surgery. And there may be other reasons why people don't opt for surgeries. They're just not ready for it. There's risks associated with surgeries. So there is a lot of things to think about when you're thinking about surgery to help diagnose or manage the pain and discomfort associated with endometriosis. But please make sure that no one pressures you or makes you feel bad for not choosing surgery as an option, as again, there are risks associated with surgery as well. So keep that in mind, and just a little disclaimer from me to you, friend to friend. There's no pressure here on my end, just an informative video to help you kind of make a little bit more of an informed decision when you're thinking about surgery to help manage and diagnose endometriosis. So with that in mind, let's first jump into what ablation surgery for endometriosis is, what it looks like, and how it may or may not be a better option for endometriosis treatment. Okay, so I'm a visual learner, and I don't know if you're the same, but I'm going to describe ablation surgery via this beautiful flower from over there. So ablation surgery is a minimally invasive procedure that is typically done through laparoscopic surgery. Laparoscopic surgery is when tiny cuts or incisions are made on the individual's abdomen. The pelvic zone is typically investigated first. So the camera and surgical tools are used in this procedure to see through the visual eye if endometriosis, adhesion, stroma, or tissue is present. The tools are used through that surgery to help treat the disease on site. So using this flower as an example of endometriosis has never looked so beautiful and smelled so beautiful. But when we look at endo, this flower petal at the top we'll see as the actual tissue that would be seen by the camera being inserted during that laparoscopic surgery. So this pen is the camera. Oh, we see endometriosis tissue, but we don't necessarily see on ablation techniques the rest of the root of the disease in the remaining part of the skin. During ablation surgery, we don't necessarily know how deep the endometriosis tissue extends or how wide it extends. So we only typically see during ablation surgery the first little hint of a disease on the surface of the skin. During that laparoscopic surgery, the surgeon will burn the top surface of the endometriosis tissue at the surface, leaving the root and everything behind, but that top surface is burned through a laser or other techniques to burn or ablaze that top layer of the endometriosis tissue that's present. So once that's happened, that top beautiful part is covered. The endometriosis tissue is burned, but that root still remains. We again don't know how deep the tissue goes. We don't know how wide it extends, but that top layer of the disease has been burned. Typically, this type of surgery leaves extensive scar tissue. In a lot of cases, unfortunately, with ablation surgery, so that burning technique, a lot of individuals experience extensive amounts of pain because of that built up scar tissue being developed. Now, extensive scar tissue can lead to additional pains and complications. So ablation surgery doesn't treat the root cause of the disease, it's still left behind. And typically with ablation surgery, it is more likely for the disease to grow back in a shorter time frame, typically in a couple of months or in a year or two, depending on your body and your endometriosis disease presentation. But typically with ablation, the disease will grow back because the root of the disease still remains. Now, it's really important to note that with ablation surgery, typically there's less post-operative pain, there's a shorter recovery period, and reduced risks of complications associated with a more extensive surgery type. Ablation surgery can provide relief for individuals suffering with endometriosis pain and discomfort, and typically ablation surgery is a less expensive option when compared to excision surgery for endometriosis. Additionally, this type of surgery may not be suitable for all types of endometriosis presentations, so the decision to undergo this type of surgery should be talked about with your healthcare provider and definitely investigated further on your end to see if that's an option that you want to opt for. One thing that does concern me as a patient and someone friend to friend around ablation option is that normal gynecologists are performing ablation surgery. Nothing against gynecologists, they're really important, but you want to make sure that an endometriosis specialist is on your team and performing the procedure. Gynecologists, compared to endometriosis specialists, don't have the extensive training and knowledge to identify certain types of endometriosis presentations during surgery. You don't have the extensive training when it comes to endometriosis surgery. You want to make sure that an endometriosis specialist is performing the type of surgery that you opt for so that they recognize the disease and how it presents differently on different bodies. Endometriosis specialists also make sure that they protect sensitive areas that are impacted by endo. Again, it can grow on delicate areas like fallopian tubes, ovaries, bowels. So you want to make sure that someone performing the procedure protects and maintains the integrity of those structures in the body to make sure that there's no additional complications or risks when it comes to your surgery. So that's my concern when it comes to ablation, that sometimes gynecologists and other medical professionals are performing ablation surgeries when you want that endo specialist on your team. I hope that has provided a little bit more explanation on ablation surgery for endometriosis. Now let's jump into excision surgery for endometriosis. It is still conducted through laparoscopic surgery, so again, those keyhole incisions, but it is a little bit more of an invasive procedure. Typically with individuals with excision surgery, there is a longer recovery time when compared to ablation surgery. It can be a more expensive option, but this option does provide long-term relief in comparison to ablation surgery. Okay, so the difference is, again, with ablation, that disease is just burned at the surface, root remains. Now, when it comes to excision surgery, just like the name suggests, the entire endometriosis tissue, lesion, and adhesion is excised or removed from the body. This beautiful flower petal is removed, the root is removed. So we know during excision surgery, the depth and the width of the tissue and how extensive it is. So we remove the entire root cause of that pain and discomfort in the body. It's more invasive because it does dig deeper and wider depending on how extensive the endometriosis tissue is, and that's why it may cause a longer recovery time during this surgery. The advantages of excision surgery is that there's complete removal of the endometriosis disease that's causing pain and discomfort. In a lot of cases, they're able to preserve healthy tissue. With excision, you can have a better diagnostic outlook on treating and managing the disease. Excision surgery is a complex procedure, so you want an endometriosis specialist on your surgical team to perform the surgery. And again, with any surgery, there are risks and complications that come with surgery. So again, it's really important to make a pro and con list for yourself to make sure that surgery is an option that you're willing to take on. Always talk to your medical provider or family doctor to talk about the risks and benefits to each option. I hope that this video has helped gain a little bit more insight into the two surgical options for diagnosing and treating endometriosis. I went through my own endometriosis consultation for surgery before the pandemic, and it was a very overwhelming experience for me. I was like, why is this happening to me? Why am I making this decision about my body when I didn't do anything to cause this pain and discomfort? Endometriosis found me. I didn't find it, trust me. And sometimes there are things that come to our doorstep that we have to deal with. And that's just generally in life, whether it's a disease or it's another thing that happens to us. And that's when we see our true strength rise and our courage and our determination for answers. And so if you're in this chapter book right now of deciding if surgery is for you, know that I'm thinking of you and that whatever you decide to do, I support you 100% of the way. Whatever works for you and your body and your journey works for me. There's no pressure here on my side, but I just want you to make sure that you talk to a doctor along the way to just gain insight and resources and information that is beneficial. And just know that it can be a very overwhelming experience, and it's okay to take a day, a week, a month to just sit and just really dive deep into if a decision that you're going to make is right for you or if you're ready for it. It can be overwhelming to make a decision right away in the appointment room with a doctor, especially if you're feeling pressured of, oh, our wait lists are really long, like you have to decide now. And it's like, let me have time to just figure it out. I know in Canada, the wait lists for surgeries for endometriosis are ridiculous. They're out the door. People are waiting 2+ years for surgery and pain management options for them. We have the right specialists in the country. We just need support from governments and more resources and more funding to get those surgeries happening and the support that specialists need to perform that surgery. So if you're in the healthcare profession, a huge thank you to everything that you do to support endometriosis patients. And if you're a patient waiting for surgery, know that I'm thinking of you. I can't wait to hear down below in the comments if you're willing to share if you've gone through surgery and how you felt about making that decision, and any words of encouragement for those that are waiting for surgery or thinking about surgery, and something that would help make them feel a little bit better about that waiting process or that procedure. With that, I hope this video has helped provide a little bit more information about the two options for surgery for endometriosis. And with that, I hope you treat yourself to a flower or two today or this weekend. I can't wait to talk to you on the next one. In the meantime, I hope you have a flare-free day and week ahead. Bye.